Did you know that once you've had chickenpox, your body creates an immunity to the virus that prevents you from getting chickenpox again? However, you may be at risk for getting shingles. This may cause some intense pain and discomfort, as some of the common treatments for shingles are ineffective. Let's take a minute to learn about shingles. The pain and the itching can be treated with CBD oil. Let's learn how, coming up next. What are shingles? This is an itchy rash caused by a contagious virus known as the varicella zoster virus. This is the same virus that causes the chickenpox. Once you've been exposed to this virus, it can remain dormant in your nerve cells for the rest of your life. Later on in life, the virus can activate and come back as shingles. This virus lives deep inside your nerve cells after you've already had chickenpox and can reappear at any point in time from those affected nerves to affect the skin. Signs and symptoms of shingles. The most common shingles symptom is a blistering rash. And initially, before the rash develops, you may experience some severe pain in the area. It's a bit tingly and has a burning sensation that will last a few days. Once the red, itchy, burning rash appears, a few days later, you'll usually get these little pustules that can be quite uncomfortable. You may also experience fatigue, fever, migraines, abdominal pains, and light sensitivity. Who's at risk for getting shingles? Fortunately, not everybody that's had chickenpox will develop shingles. About 1 in 3 adults will develop shingles. Many of those will develop shingles multiple times throughout their lifetime. Although research hasn't established why some people get shingles and some people don't, here are a few of the risk factors that are common for developing shingles. Being over 50, having a low immune system, stress, some types of medications such as steroids, some cancer treatments such as chemotherapy and radiation, and exposure to other diseases can exacerbate shingles. Shingles treatment. Shingles has no cure, but when treated promptly, it can minimize symptom and side effects and complications also. There are antiviral drugs that you can get via prescription that will decrease the time that your shingles outbreak occurs. However, it may take 3 to 5 weeks for those blistery, itchy rashes to disappear. And like I said before, you may get shingles multiple times in your lifetime, so after you've had it and before you've had it, it's good to develop a game plan for what you're going to do when you start experiencing the symptoms. CBD for shingles. Shingles are quite painful and the treatment options are very limited, and this is where CBD comes into play. CBD products come in the form of supplements, gummies, and oils. CBD contains cannabinoids, which are a natural ingredient that the body uses to decrease inflammation and also decrease pain associated with shingles. CBD has been studied to decrease shingles pain and also other nerve-related pains. CBD as pain relief for shingles. When you experience extreme pain, your body's very sensitive and it produces a substance called anandamide. When you use CBD, it helps your body regulate its response to pain. Research indicates that there's a link between CBD and pain management that is equivalent to traditional therapies. When treating shingles pain and itching, you should opt for CBD for the reason of decreased side effects and lower risk. CBD for inflammation. As it contains anti-inflammatory properties, CBD reduces the chemical imbalances that cause inflammation in the body. You can even apply CBD directly to the rash, and it's going to eliminate some of the inflammation at the site, which is going to decrease some of the pain and also decrease some of the itching and uncomfortableness that comes along with having shingles. Dosage in the right amount of CBD for the treatment of shingles. As CBD comes in a variety of products, patients have the option to choose the form that they're most comfortable with. I recommend that you start low and go slow. For pain relief, the daily oral dose is going to be between 20 and 25 milligrams. This dose may be adjusted up and down due to tolerance of CBD and how it differs quite a bit from person to person. And remember, for many people, CBD cream can cause instant relief when it's applied to the site. And with CBD cream, you use enough to cover the affected area. As long as you continue to feel that itchy, burny, irritating feeling in the affected area of your shingles, continue to use that shingles cream until the feeling completely goes away. Applying CBD cream directly to the affected shingles also will decrease the chance that you'll get an infection at the site as those blisters pop. Final thoughts. When you develop a shingles outbreak, it's just extremely important to start treating immediately. As soon as you notice the signs and symptoms, whether it's conventional treatment or treatment with CBD, quick and prompt treatment is the key to minimizing side effects and decreasing complications. I also highly recommend that if you do choose to use CBD, before changing anything else about your medical therapy, make sure you contact your physician. And always remember, when trying new or natural supplements, monitor the area closely so you don't cause any unwanted damage.